Today we'll be talking about Obsessive Compulsive Disorder, also known as OCD. Hi, my name is Dr. Nafisa Sekandari and I specialize in anxiety-based disorders. OCD is an anxiety-based disorder that creates feelings of fear and worry for people who feel they can only feel good if they engage in certain obsessions or compulsions. People who suffer from OCD tend to engage in repetitive behaviors or actions even though they know these behaviors are irrational. Although OCD can create a lot of emotional pain for those suffering, I tend to believe that OCD can be one of the best disorders to have if you know how to manage it. The majority of people with OCD are highly intelligent, achievement-oriented, driven, organized, detail-oriented, and clean. Many of the common fears associated with OCD are the things that society actually rewards, such as cleanliness, being healthy, or being in control. OCD can begin to cause problems when it's no longer in our control and actually begins to control us. There's a difference between liking a clean house and feeling like the world will end if your house isn't clean and organized to your standards. There's a difference between washing your hands after touching something dirty and washing it repeatedly because you feel the germs are not coming off and you're not clean. A few examples of famous people that have OCD are Jessica Alba, Leonardo DiCaprio, and Howie Mandel. The actress Jessica Alba's OCD revolves around her excessive need for control in her life. I personally see OCD as a spectrum disorder and see my patients being somewhere on the spectrum of either mild disorder to extreme disorder. The people on the highest end of the disorder behave similar to Jack Nicholson in the movie As Good as It Gets. In the movie, Jack Nicholson is living an isolated life due to his struggle with OCD. His fear of germs, his struggle with social anxiety, and fear of the unknown creates a limited world for the character. For people on the higher end of the spectrum, OCD can become debilitating and restricting. People on the high end of the spectrum tend to be totally controlled by their obsessions and compulsions and feel powerless with it. People on the lower end of the spectrum can be more functional. They're able to maintain jobs and have relationships, but the OCD can still create problems in their lives. For actress Cameron Diaz, her OCD doesn't stop her from acting or living her life, but she tends to have an extreme fear of germs and will not touch doorknobs. Howie Mandel is famous for his fear of germs and known to wash his hands frequently. Katy Perry has to brush her teeth 4 to 6 times a day. Although it's great to have good oral hygiene, 4 to 6 times would be considered extreme even by the American Dental Association. Justin Timberlake tends to be very organized and will only allow certain foods in his refrigerator. Some people will only eat certain foods and may even fear other foods. I've known children that won't eat any food that's green. OCD can also affect our body image and force people to diet or exercise excessively. Many people fear leaving their house or being separated from their loved ones. One thing I've noticed about OCD is it's highly genetic and we usually inherit it from our families. There's nothing we did or even they did for us to get OCD. We get it the same way we get our hair color and eye color. But just because we have it doesn't mean it has to become debilitating. People can and have led healthy and normal lives after learning to manage OCD. OCD can be wonderful and beneficial once you know how to take advantage of it and take back control and use it to help you in your life. Who doesn't want a clean and organized life? Who doesn't want to stay healthy and in shape? The difference with being in control of OCD and allowing OCD to control you is the fact that you're choosing to be clean and organized instead of feeling anxiety and stress about the need to be clean and organized. OCD is manageable, but not always easy or simple. You will need help to get back control of your life, but know that getting that control is possible. Go ahead and leave me a comment about your personal struggle with OCD and what, if anything, you've done to control it. I would still love to get your questions for future posts, so if you have any questions related to mental health and illness, please message me either at my Facebook page, Dr. Sekandari, or on Instagram at Dr. Nafisa Sekandari. Looking forward to hearing from you. Until next time.